Hi, it's Dr. Jim Haley, and I just want to speak for a few minutes about vaginal laxity, uh, something that is on the minds of a lot of women for different reasons. But first off, to let you know that it's something that is normal. It is something that occurs very, very frequently. And even though it's not of any huge concern, it does cause women to have anxiety for different reasons. And so I was just going to mention a few things about it. Now, what is vaginal laxity when we use that term? Well, basically what it means is that the vaginal tissue has gotten stretched out for different reasons, far and away the most common being childbirth, which I'll mention a little bit more in a second. But the vaginal tissue is naturally full of collagen and fibrin, and it's like that so that it can accommodate when a baby comes through the birth canal, and so that's good. However, when that occurs, things can happen as a result, and so it is good that we have that stretchiness of that tissue, so to speak, but then following delivery, we can see some results of that aren't necessarily to a woman's liking. So birth occurs and then this tissue gets stretched out. Now, in a similar way to if we have a rubber band that, say, we stretch out to a degree, it can come back, but just does not get back to what was normal. And so we see that to varying degrees. Now, with that stretching out of tissue and then loss of some muscle support, this occurs as the baby comes through the birth canal, and it just cannot help but, in a sense, happen. And along with that, we can get nerve damage, decreased sensitivity. So now the vagina is lax or stretched out or larger than a woman may like. And so that might create concerns, problems for her. One of the biggest things may be appearance. Another thing may be with intercourse, that intercourse just is not as pleasurable. The vagina is a little bit larger, there's less friction, so it just doesn't feel quite as pleasurable. So these things can, like I said, create some problems or anxiety. Now, it's not a health concern, but if there is a desire to do something about it, some of the more simple things would be Kegel exercises, which can help to a degree. It can't, again, return things back to how you might like, but Kegel exercises, there is pelvic physical therapy that's available, things like that. Now, if there is a desire to try to correct that, some terms that you may have heard that reference that would be vaginal rejuvenation or vaginoplasty, and that term plasty just means surgical correction, like plastic surgery. That's where that term is used. So this type of surgery or procedure can be done to help. And so what is done is the muscles that form the pelvic floor and in a sense hold the vagina in place, that and certain tissue can be reconstructed, excess tissue can be removed, and by doing that, really look to get the vagina back to as best a state as possible, even a pre-baby state. So if that's desired, the two things I would tell you about that is, one, wait till you are finished childbearing, so that once it's done, there's no risk in a sense messing that up. The second thing is that if you're going to look to have that done, make sure you go to a qualified surgeon, someone who is experienced with pelvic reconstruction, because obviously if you're going to go through the time and trouble to do this, you want it done right. So hope that gives you a little bit information, and as always, if we can help you in any way or want to have a consult, feel free to give us a call, and we'd be more than happy to discuss this with you. So thank you.